Good morning, everybody, and thank you, Dr. Desai, Dr. Katrak, for this opportunity to talk in this meeting today on the Jaslok Founders Day event. So the talk given to me today was how to manage dialysis during the COVID era. Last 4 months have been, never before phase in our life as a doctor practicing, where we have seen a new disease take on all kinds of shapes and colors, so to say. For the kidney, the COVID-19 has presented right from an asymptomatic urinary abnormality presentation to the patient with acute kidney injury requiring dialysis. It has pushed patients with stable chronic kidney disease onto dialysis. It has manifested with different ways, proteinuria, hematuria, the works. So it is like presenting as possibly everything in our patients with kidney disease. So particularly today we are going to talk about the dialysis patients and COVID. You must all be remembering 3.5 months back, when the cases in Mumbai started, the newspapers were full of articles about, COVID in dialysis. So dialysis units were getting shut, people were trying to go, find another place to do dialysis, all sorts of things, guidelines changing rapidly. So when I was looking at this talk, I said, let me try and bring out to the fore what are the issues that were actually happening. So why are dialysis patients a special population? See, in COVID, what is everybody doing? They're staying at home. What do these patients need to do? To stay alive, they have to go to the hospital 2 or 3 times a week for dialysis. 4 hours of dialysis and travel time, that's 5 to 6 hours. Second thing, they are clustered in a unit. When people are afraid to share rooms with other people, there are 8, 10, 12 patients in our Jaslok unit. Even though it's such a large size unit, maintaining social distance, patients are clustered. In India, 99% of the patients, they reuse the dialyzers and for cost issues. What do you do about reusing dialysis in COVID times? And the world over, the data was that this patient there's a higher mortality in this group of patients. So when I started preparing for this talk, I said, I'm going to look at it from different perspectives. So what is the patient saying? What are the technicians and nurses working in the unit? What about the doctors, the hospital and the government? So different stakeholders in the dialysis population. And let us look at this particular issue of dialysis in COVID era from different people's vision. So now look at the patient. What is the patient's primary worry? The fear of getting COVID. Oh my God, nobody's stepping out of the house and I have to go to dialysis unit. And who are the patients on dialysis? Usually senior people, elder people with diabetes, heart disease, and now they are at risk of getting a COVID. If they got COVID, initially at least, now it's getting better, but there was a stigma associated with it. So everybody in the building wanted to dissociate from them. Nobody even wanted them to come into the building. Social isolation to the extreme. Then the other issue is, there's a higher risk of mortality. These patients are, like I said, the sicker lot. So at least the international data was that they will have much more mortality. I am not sharing with you the Indian data today that we have prepared with our Jaslok team, but that will be soon in press that I can share with you. So dialysis units patients have to go to the hospital twice or thrice a week and they have a much greater exposure, like I said before. Then to add salt to injury, you have the issue of increased costs. Now everybody has to use PPE. Who is going to bear the cost? PPE and 95 masks. And that is, where people are actually, they should be thankful to Jaslok Hospital, which has taken on a lot of burden on itself and has passed on very little to the patient so that to help them through these difficult times. So traveling, patient can't come alone for dialysis, most of them. They need a caregiver to transport them back and forth. The patients are elderly, frail, they are dependent on others for routine activities. No longer is a caregiver allowed inside the hospital or in the dialysis unit. So to feed them, to look after them for those 4 hours, nobody is allowed. Of course, for their own good, but patients some of them were viewing it as inconvenience, which is true. And the worst is fear of not getting a bed if they become COVID positive, because not just getting a bed in a COVID unit, but getting a dialysis bed in a COVID unit. Now you can understand how difficult it must be. So this is from the patient perspective, right? Now look at the healthcare workers. So these technicians, nurses, hats off to them for the amount of work they have done in this COVID era with all the fears of they are like all of us, right? With family people, with children and everybody having to go through this stress, wearing a PPE where you start sweating in 20-30 minutes after wearing a level 3 PPE. They are in those for 8 to 9 hours of their shift. And every day that duty continues. Maximum risk of exposure because they are in that unit with the patients, and a lot of these patients were testing positive. particularly when we were doing asymptomatic screening, we had a huge turnover. So just imagine trying to dialyze a COVID patient. You need to be brave to do that, right? Transport from home to the hospital, these lockdowns that were kind of in place for the first 70 days, for good reasons obviously, but it made difficult for people to travel from their home to the hospital to give service. So it was said that they were being looked after, but on the ground situation was not the same. They had to face real difficulties to travel, and of course the fear of getting COVID, which cannot be overemphasized. So this is from the technician's point of view. Now just imagine, the dialysis unit at Jaslok has worked continuously since day one of the lockdown, and not a single day when the dialysis was refused to the patients. We have initiated SLED or ICU dialysis, what we call a slow low efficiency dialysis, and even continuous renal replacement therapy. The 24 hours dialysis has been done for COVID patients in our hospital whenever it was needed. And like I said, the technicians and nursing staff are the main pillars on which the dialysis unit works, and they have done a commendable job in this emergency. The doctors, the resident doctors, working every day since the COVID started. Of course, they are taking full precautions, not removing their masks, wearing the full PPEs. But just imagine, you see a patient today, tomorrow oh, that patient you saw yesterday, he's positive. And it has happened to me, it has happened to every single practicing doctor. And are we worried? Yes, we are. We are all humans. We are worried of getting COVID. But at the same time, what have we done? We have not sat at home. We have worked throughout the COVID epidemic. And every single day we have come to the hospital to look after our patients. We have done what is best for the patients. And at the same time, tried to look as well after ourselves as we possibly could. Now, what about the hospital? Look at the hospital perspective of this situation. We have looked at the patient's perspective. We have looked from the caregiver's perspective, the healthcare workers, the junior and the senior doctors on duty. Now, what about the hospital? Now, for the hospital, dialysis is not a revenue generating area. So from their perspective, it's a service that they are giving along with other facilities to the patients. Now, because of this service, patients turning positive, risk of entire hospital getting lockdowns. This was before. Now it is no longer happening. Thank God for that. But this was the order of the day when it started. Hospitals were told to shut and disinfect for 24, 48 hours, and without making adequate alternative arrangements. The first month of COVID was hard on me also, because I used to get panic calls from units shut down, major hospital units shut down, and patients in a panic, where will I get my next dialysis? If I don't get my next dialysis, I will die. And where are we supposed to arrange it if hospitals are shut down suddenly? So it was really hard, and thank God it has stopped. Look at hospitals, what they have done. Jaslok has provided PPE kits to doctors, nurses, and all patients working in the hospital. Accommodation was provided for patients on COVID duty. And for this, a big hats off to the entire management team. I don't know how they have pulled it off, managing to accommodate so many people within the hospital campus, out of the hospital campus, arranging their transportation so that they are available for patient care. And this is something unbelievable what they have achieved. Salary of hospital staff, these are, nobody can live without their regular monthly salary. So when the hospital is not generating income, you still have to pay the staff to carry on. And this was hard for the hospital. And hospital staff, now when they become positive, where they do go? Where will they go? So providing hospitalization for COVID positive hospital staff. So hospital has taken a lot on itself. A big thanks to the management and to the trustees for doing everything that they have for the patients and the staff during the COVID era. We have seen it with our own eyes. Transportation for doctors, nurses, and all other staff, food for the hospital staff, food for the patients. Small things became very important at this point, all of which has been wonderfully taken care of by the hospital. So what are we doing at Jaslok in the dialysis in the COVID era? So dialysis unit at Jaslok is working non-stop since day one of lockdown and has not denied services to any dialysis patients. We have always made alternate arrangements whenever it was needed. Dialysis of COVID positive patients, CRRT, SLED, whenever it was needed, it has been done. We have continued all nephrological services in the hospital. We have done kidney biopsies on regular patients as well as COVID patients during this era. Permanent catheter insertions we have done AV fistula surgeries, PD catheter insertions, and we have come back to the time when we have started transplants. So cadaver transplant has already been done in this hospital, and one patient of mine for living related kidney transplant is posted for Monday. It's already admitted with the hospital. So we are trying to come back to steam, knowing now as a fact that the COVID is not going away. And when it will go is anybody's guess. We have to learn to live with COVID. as the patients have already learned. So what are the take-home messages? So take full protective measures in the form of PPE kits, wear your N95s, wear your masks, wear your glasses, make sure your hand washing is adequate, wear gloves when necessary, PPE kits as per the level of exposure anticipated, treat and manage every patient taking precautions. Just think that every patient is COVID positive and then do what you will do so that you are not going to feel unsafe after the exposure. For the doctors, nurses, and other technicians, please take a proper diet, not a time to get into any food fads, proper nutrition, and good sleep. Very essential that we maintain our immunity. COVID is going to be a part of our life. Accept it and take full protective measures and try and see patients as previously. The more we believe that all is well and we take the proper precautions, the fear of COVID will not overwhelm us. Thank you so much for your kind attention.